Delighted to have you all here with us today. We shall start on time. Please make sure you are comfortable. Grab your coffee, water, and be excited. In the next 90 minutes, you will be engaged in exciting discussion with our esteemed panel of resource speakers that we have pulled for you today. So we will also have a breakout sessions where you will be engaging in a more detailed conversation with our resource speaker. So it is my pleasure to invite World Vision's regional leader, Chirian Thomas, to officially start our learning exchange. Over to you, Chirian.
Thank you so much, Kat. And I would again once more like to thank and greet everyone who has joined us this morning, afternoon, or evening, depending on where you are. World Vision South Asia Pacific Learning Exchange is a series of e-plenaries that would bring together government, UN agencies, donors, civil society organizations, corporates, academia, subject matter experts, thought leaders, and for us, most importantly, children, who are able to come together and discuss some of the most pressing issues that affect vulnerable children in our region. Yesterday was the World Food Day, and there have been several events and talks on this whole issue of malnutrition. And as we all know, our region, the Asia-Pacific region, has highest levels of malnutrition in terms of number of children, and certain countries have very, very high levels of stunting in our region. And we know that this is a very critical issue that needs to be addressed so that children can reach their fullest potential in life. We believe a life of plenty for every child is possible. There is enough food. And that is why we have this whole campaign that we have launched globally called the Enough campaign, saying that there is enough for every child to grow to her full potential, to make sure that at the end of the day, there is enough food, nutritious food to go around. So we are really grateful that all of you are able to join us today as leaders, thought leaders, panelists, panel discussants, and also all the participants who would together be able to looking at this issue. We are particularly grateful to our partner SUN-CSN Asia Network and its various members in countries across Asia and the Pacific, various UN organization partners that we have, WFP and UNICEF, and various colleagues in the development sector, academic institutions, and children who are part of this effort. We want to really thank our resource persons who have dedicated their time and expertise in making this event possible. And a special thanks to Emily Monville of SUN-CSN for co-hosting this learning exchange. And a special thanks again to WFP and UNICEF for their collaboration. We really do hope that as we talk about this various pressing issue of social behavior change and the way it impacts nutrition, we believe that it will help the various interventions that we have as various organizations, peer organizations, stakeholders in this process, which we are implementing across the region, which will be useful for effective programming. And that coming together, discussing, sharing experiences would be a way we learn from each other and grow in this whole area of making sure at the end of the day, children grow to their fullest potential and enjoy fullness of life in the South Asia Pacific region. So thank you again once more for this time that you are spending with us this morning. And we do hope that you will find that this time has been truly well spent as you listen to the various studies and reports that are disseminated, the various thoughts that are shared, that it will be indeed a very useful time that you spend with us today. Thank you so much once again for joining us. I'd request Sarah Berup, my colleague, who is the Chief Operations Officer for the South Asia Pacific region, to make her introductory remarks.
Thank you kindly, Chirian. And it's such a pleasure to see so many people joining this webinar. I can see the participants going up every minute. I really just want to touch base about why we're here, why we've taken the time, all of us, to listen. And it's really about why social behaviour change on nutrition is so critical. We know in this region, the South Asia Pacific region, that we face alarmingly high rates of stunting and malnutrition, while the shift to processed foods has driven up obesity and related health issues like diabetes and also cardiovascular disease. Factors like the COVID-19 pandemic, climate extremes, civil conflicts have all exacerbated food insecurity across this region. And in this sense, it's crucial to promote diverse diets as well as health-seeking behaviours through social behaviour change communication to improve children's health and well-being. World Vision has conducted research into effective social behaviour change tools and also approaches that we've implemented in our projects. And today we're really excited about sharing these findings with you all. There are many organisations who are tackling malnutrition using different strategies to drive positive behaviour change in households and communities. And it will indeed take a collective effort, collective action, as well as genuine partnerships, such as those that are present today, to indeed achieve this. This learning exchange offers an opportunity for everyone to discuss the effectiveness as well as the challenges of various SBC tools in the region and really to foster cross-learning. That's why we're here. We certainly want to engage with you all. We see the need to do a great deal more cross-learning in this space. And we certainly value your feedback. We invite your participation today as well as in upcoming exchanges as we continue our efforts for the well-being of children in the South Asia Pacific. Finally, I've said this before and I will share it again today. I don't believe we can expect our children to go to bed hungry and still have hopes and dreams of a positive future. We owe them this, to take collective action, to create positive change. And I certainly thank you for being here and also for everything you do for the well-being of children across the South Asia and the Pacific. Thank you.
Thank you. Thank you very much, Sarah and Chirian. Indeed, we have those big dreams for our children. Now let us spend some more time to share with you about the social behavior change framework used in the report that we would like to share with you, the report led by World Vision. And we will be hearing from our Senior Health and Nutrition Technical Advisor of World Vision International, Esther Indriani. Over to you, Esther.
Great, thank you so much. Yes, I hope you can hear me clearly. My name is Esther Indriani. I'm working as a Global Senior Technical Advisor for Health and Nutrition at World Vision International. Today, I'd like to share with you the Social and Behaviour Change framework from World Vision and the lessons learned and recommendations from our SBC programs. In 2024, World Vision conducted a review of our health and nutrition programs and looked into how we have been doing social and behavior change. World Vision has conducted many studies globally to understand why some people do and other people don't do the behaviors that we desire. We found that there are multiple behavioral drivers started from what's within the individuals or agency, such as skills and attitude, all the way to high-level systems such as policies. And these drivers can be both barriers and enablers to behavior change. And based on this experience and using social and behavior change theories, World Vision designed our SBC framework, which is the picture on the left. Using the SBC framework, we conducted a review of how World Vision did SBC for nutrition with the help of our consultant, Peter Smith, and took 3 samples of multi-sectoral nutrition projects in the South Asian Pacific region. The result of that review is now published as the report titled Shaping a Healthier Future for Children, and we will be happy to provide you with the link to this report in the chat. In South Asia and Pacific region, World Vision works in 10 countries to address maternal and child malnutrition. From the 3 projects highlighted, in Bangladesh, Indonesia, and Timor-Leste, we found that there are common strengths across the 3 projects. That we work multi-sectorally beyond health and nutrition, we address barriers and enablers at several levels, we ensure gender equality and inclusion, and we build on local insights. Talking about SBC, it is about coordination of efforts happening at different levels and coordination with different sectors. In simple terms, in SBC, we aspire to understand what makes it difficult for people to practice the behavior or barrier, and what should be done to reduce the barriers and make it easier for people to change. Perhaps one of the most important key messages in SBC programming is to realize that we may have the tendency to think that people don't do a behavior because they don't know about it. But this is not always the case. So, to be effective, SBC must cover other interventions than just telling people about it. To illustrate how SBC works, I would like to share with you the socio-ecological model of behavior change, one of the many theories on behavior change. It shows that at the center is the individual, but anyone will have influence from their significant others, either husband or wife, family, teachers, community leaders, their peers, and at the highest level is how environment and policies enable us to practice the behavior or not. For instance, in a nutrition project, we might be thinking that if child feeding practice is not good, that's because the mother is unaware of good child feeding practices. For us who are here today and who have worked on nutrition behavior change in the past, we know that educating mothers is important, but it is not enough. We also need to see how mothers are supported by her family, how she can get food for her child, how community perceives child feeding, is there any food taboo, how about food availability, how about the presence of nutrition counselors who can teach mothers on how to feed the child. Even how soon the mother should go back to work after giving birth will determine the success of breastfeeding. All these are interconnected. In World Vision's SBC framework, we also have the process of facilitating social and behavior change. We learn from existing SBC tools that we have used in the past and also from the government and partners. The first step is to conduct proper formative research and assessment for SBC in order for us to understand the behavior and its context. Then we need to engage community and stakeholders. We need to identify the barriers and enablers, and we need to design the SBC interventions and pre-test them. Once we have a good quality SBC interventions, we can implement those interventions and monitor, learn, and adapt those interventions. Lastly, we want to evaluate and scale up effective SBC interventions. Today, in the breakout rooms, you will be able to hear presentations of various tools for SBC that will be used at different steps. For example, photo voice and barrier analysis are tools for formative research to understand the behavior and identify barriers and enablers. As a final remark, the report provides recommendations for decision makers and for implementers. You will be able to read in more detail those recommendations in the report. Today, I would like to highlight 3 important points. First is to invest in proper situation analysis and formative research. 2, to invest in building capacity of community agents of change, as they are the most important facilitator and communicator to our target populations. Many times we are busy preparing communication materials, but we should not forget to build the skills and capacity of these community facilitators, counselors, and home visitors, as they will determine the success of our SBC programs. And lastly, number 3 is to base our SBC design on theory of change and develop using data and our understanding on the behavior and the community. This will make our SBC strategy and design strong. Yeah. Thank you very much for your kind attention, and I'll be very happy to respond if you have any questions. Back to you, Kat.
Thank you very much, Esther. Such a concise presentation. What I'm really getting from your presentation is information does not always equal to positive action. And that's why we need to understand more about SBC and the tools. So friends, if you have questions for Esther, please put it in the Q&A, or you can also put it in the chat box. We will be addressing those later on. Now, an even more exciting discussion, which will be led by Emily Monville Oro, the Senior Regional Advisor of Scaling Up Nutrition, Civil Society Network Asia, or SUN-CSN Asia, who is also the co-organizer of this learning event. Emily will be moderating this panel discussion. Please take it away.
Thank you very much, Kat, and good day to everyone, especially those who are members of the Scaling Up Nutrition Civil Society Network. Of course, first and foremost, I'd like to thank World Vision, especially Kat, for reaching out and allowing us to co-organize this very important social behavioral change webinar this afternoon. And as you may know, I think we have had a lot of interventions related to SBC, and Esther had shared a very important framework on social and behavioral change. I really liked it that she had mentioned that it's not merely promoting information or raising awareness, but really understanding context, the barriers, as well as the factors that enhance adoption of a particular behavior. But I'm sure most of you will be asking, how does it look like on the ground? So at this juncture, we will be hearing some experiences of the implementation of social behavioral change in various countries. So we have invited two speakers, and we would like, of course, to thank them for agreeing to share with us their experiences and expertise. So we have with us Ms. Evangelita de Costa Pereira. She's the maternal child health and nutrition specialist of World Vision Timor-Leste. Hello, Eva.
Hi, Em. Hi, Emily.
Thank you so much. And our second speaker will be Mr. Dawar Adnan Shams. He is the National Campaign Manager of Nutrition International Pakistan, who is a very active and mature civil society alliance member of SUN-CSN Asia. Hello to you, Dawar.
Hi, Emily, and hi, everyone.
Okay, so I think we can start our sharing and conversation. So first of all, I'd like, of course, to give you the time to share with us your experiences. I'm sure there is a lot for you to share in terms of the issues and challenges that you have been confronted with in your efforts to implement SBC. So Eva, can you share with us your experiences, and maybe a lot of audience who's with us today would be very interested to learn about your efforts on the ground. Over to you, Eva.
Sure. Thank you very much, Ate Emily. Hi, everyone. It's such a privilege for us, for Vision Timor-Leste, to be given this chance to share our field experience in regards to SBC interventions from the field. So today I'll be sharing some of our experiences from our project, one of our big projects that we call Better Food, Better Health project. I just briefly talk about this project. So Better Food, Better Health project is a nutrition sensitive agriculture project where we work together with the communities through the community groups that we establish at the sub-village level to grow nutritious food, local foods that are high in protein and iron, but these foods are being underutilized due to lack of knowledge as a way of addressing low dietary diversity issue that often leads to high malnutrition rates. So as you can see from this slide, this local food that we are promoting, we call it superfoods. There are 6 superfoods that we are promoting through this project. So these are soybeans, mung beans, red kidney beans, orange sweet potato, moringa leaves, and eggs. So this is just a brief overview of the project. Next, I would like to talk about the challenges that we are trying to tackle through this project. So limited knowledge of optimal nutrition practices among parents and caregivers, limited access to nutritious foods, be it due to nutritious food not available within certain period of time, or lack of affordability, lack of money. Many times the parents are not having enough money to purchase nutritious food. So those are the causes of this limited access to nutritious foods. And also food taboos. It's very common here, especially during pregnancy. Like most of pregnant mothers, they are not allowed to eat certain nutritious foods because of the myths or false belief about the consumption of the nutritious foods. And also lack of men's participation in childcare. So next, what we are doing to tackle these challenges, as you can see from the first slide, the second slide, that we established some community groups there. For example, parents clubs, farmers groups, producer groups, where we work together with them to grow these superfoods, and also work with the producer groups to produce these superfoods. And also we work together with the parents clubs, where parents of every month to receive the information around nutrition, health and nutrition, and WASH. And there are a lot of activities that we carry out at Parents Club, and we rely on the health volunteers, the local health volunteers that we call PSFs. So these PSFs are coming from within the community. So they know the communities, they know which parents are vulnerable and which parents really need their support. And also, another challenge that we are facing at the ground is the lack of participation from men, because they always think that childcare is the responsibility of mothers or women. So to address that, we have specific activities that target men. For example, we call it nutrition course for men, and we also involve men in cooking competition or cooking demonstration, just for them to be able to share the household chores at home. And also, recently we produced a superfood cookbook where all the steps are in pictures. So it's very easy for the PSFs, the health volunteers, and the parents to follow. So these recipes are quite simple. We have some positive feedback from the community that it's easy to follow, and it's so nutritious, and also the children like the taste. So these are some of the interventions that we are doing through this project. And we have some key outcomes that we have achieved. For example, can you please go to the next slide? So some of the key outcomes that we have achieved, for example, the superfood consumption has increased from 14% to 58% in children, and 14% to 59% in mothers. So this shows that the diversity is increasing both in mothers and children. And also the percentage of children who met minimum dietary diversity rose from 13% to 55%. More men are regularly involved in feeding and caring for children, and also beliefs about food taboos, especially during pregnancy, is changing. For example, in one of our area programs, before, girls or pregnant women were not allowed to eat eggs, but now it's changing. Girls and pregnant women, they now eat eggs, and they've also changed the mindset about the myth that their ancestors or their elders believed before. So I think that's some of experiences that we have from the field at the Emily. Thank you.
Thank you. Thank you very much, Eva. Very interesting outcomes that you have shared with us. And superfoods. I don't know who among you have eaten superfoods today. Interestingly, you also discuss about the lack of participation of men in childcare. I think we will get back to that later. But at this point, I'd like to invite our second speaker, Dawar, to share with us your experiences. Over to you, Dawar.
Thank you, Emily. It's such a privilege for Nutrition International to share the journey of Nutrition International's Narishma SBC strategy, a campaign aimed at advancing maternal nutrition in Pakistan. Pradeep, if you could share the slides. Some of the challenges that we try to address through Narishma campaign. Pakistan is the fifth most populous country in the world, with 40% of its population living below poverty line. More than 1/3 of the households in Pakistan are food insecure, with less than 5% of the population covered under social protection programming. In addition, challenges to accessing quality healthcare services, as well as low levels of antenatal care and postnatal care coverage and practices negatively affect women's nutritional status. So it is very concerning that only 15% of the women of reproductive age received information and counseling on nutrition during ANC visits. These factors have a significant impact on women's health and well-being, as well as the growth and development of their children. And because of these factors, Pakistan has maternal mortality ratio of 186 maternal deaths per 100,000 births, and has the second highest neonatal mortality rate in the world, with an MR of 58 per 1,000 live births. To address these challenges, the government of Pakistan developed the Pakistan Maternal Nutrition Strategy, which recognizes the critical role of healthcare providers in reaching, engaging, and influencing women and their immediate families to promote essential health and nutrition practices. So to encompass on that, the Nutrition International initiated a Narishma campaign in collaboration with the government of Pakistan, which aimed at enhancing the knowledge and capacities of healthcare providers and key opinion leaders in advancing maternal nutrition in Pakistan. The baseline study and the market research conducted during the initial phase of the campaign informed the development of a comprehensive Narishma SBC strategy. Next is the Narishma SBC strategy aligns with the Pakistan Maternal Nutrition Strategy, and it targets different layers of healthcare providers, as mentioned by Esther, that we are following the socio-ecological model. So we target, through this campaign, we target different layers of healthcare providers, key opinion leaders, decision makers, and media celebrities as champions and campaign ambassadors to influence healthcare providers' practices through public outreach and a mass media campaign. Central to the strategy is culturally contextualized and gender-sensitive communication and advocacy messages designed to bridge the knowledge gaps and promote actionable practices. The campaign strategy focuses on holistic approach across women's life cycle, starting from addressing the nutritional needs during adolescence, preconception, antenatal, and postnatal care. Next is evidence-based approaches and channels were developed to achieve the overall goal of the campaign through interpersonal communication, targeted media, and enabling environment. Under the IPC strategy, healthcare providers were capacitated through one-on-one visits, seminars, conferences, comprehensive continuing medical education, accredited training package, publication of scientific journals, and development and dissemination of knowledge tools. Under the targeted media strategy, Narishma social media platforms, including Facebook page, YouTube channel, and dedicated WhatsApp groups were established based on the market research with total reach of 5.2 million individuals. The methods used including social media posters, infographics, podcasts, Facebook Live, quizzes, and a number of videos and shout outs by media celebrities and campaign ambassadors. In addition to that, comprehensive print and electronic media campaigns were implemented through production and airing of campaign jingle, TV talk shows, and radio talk shows, in addition to newsletters, journals, articles, and policy briefs. Under the enabling environment to support and sustain behavioral change, the campaign successfully created an enabling environment through strategic partnerships and high-level policy and advocacy efforts, which were evident through the National Policy Dialogue on Economic Case for Maternal Nutrition, where federal and provincial stakeholders adopted a maternal nutrition declaration enforcing maternal nutrition as priority agenda in Pakistan. In addition to that, the pre-election advocacy conducted through Narishma campaign engaged political parties, which successfully lobbied for inclusion of nutrition in their political manifestos, ensuring long-term commitment from the political parties to address malnutrition. The successful implementation of Narishma SBCC strategy resulted in nationwide demand for expansion of Narishma campaign. Now, the last slide, this shows various knowledge resources developed during the campaign, which were found to be effective in enhancing the knowledge and skills of healthcare providers, ultimately contributing to improved maternal nutrition outcomes in the country. Thank you.
Thank you very much, Dawar. Those are very powerful experiences that you have shared with us. There are some questions that we have received prior to the webinar, and I would like to share them with you. I think, Eva, this is for you. Mostly males cultivate and buy vegetables in developing countries. Any proven strategies to engage with men and change their mindset on nutritious food? Eva, yeah, 2 minutes, please.
Sure. As I mentioned in my presentation earlier, that we engage men in nutrition course. So because we have parents clubs, and most of men do not participate in the parents club. They just send their wives to come and participate because they have other works to do. They go to the farm. So we have created this specific session for them, just to bring the same information that we bring to the mothers, parents clubs, so that they can also get the same information and they can support their wives, the women at home, to make healthy choices around food and nutrition, for example, and involve them so they can have hands-on experience in, for example, preparing meals for their children at home, something like that. So, and also in our program, we also include the women in farmers groups. So it's both. So both of them, men and women, husband and wife, that they can also contribute in the farming, cultivating vegetables and things like that.
Thank you, Eva. Those were fantastic answers. Dawar, there's a question here about the adolescent girls in Pakistan. Can you share what BCC strategies work for the adolescent girls in Pakistan, and what were some of the key barriers that you have noted? Yes, Dawar.
Well, thank you, Emily. The Narishma campaign was basically targeting healthcare providers because, you know, as highlighted in the Pakistan Maternal Nutrition Strategy, healthcare providers are like the key stakeholders who are reaching, engaging, and influencing women and their immediate family members. For the adolescent nutrition, there are different SBCC strategies that Nutrition International is implementing. and that is through targeting adolescent girls in schools as well as out of school. So these are there are two different separate strategies that we are following. The strategy included, for example, if we talk about adolescent girls in educational institutions, so the SBCC strategy ensure the access and consumption of IFA, weekly IFA supplementation for the adolescent girls. The teachers are trained on teachers, and different community stakeholders are trained on the use of IFAs and the consumption of IFAs and the importance of IFAs as well. And in addition to that, the adolescent girls are educated and to become agents of change in their communities on the use and consumption of fortified wheat flour and fortified fortification.
Okay, thank you, Dawar. We may run out of time, but you both presented very comprehensively your experiences, and I'm sure there are a lot of lessons learned that you have generated, what work and what does not work. I think it would be good for you to share them. What tips can you also provide our participants who are here who may want to implement this type of BCC? So can you share those lessons? Eva, would you like to start?
Sure. For us, working closely together with the local health volunteers, because these health volunteers are from within the community. They live in the community, and they are also part of the government structure. So World Vision is not recruiting these health volunteers. So they are chosen by the local leaders. Therefore, they are trusted, and to work through them has given a bonus for us, where community will listen to them, and they will live there in the community as role models. In gender, for example, we have male volunteers where they really take up the information around gender and would like to challenge the gender norms that are there in the community. So they really live up to the knowledge that they receive through trainings. So it's really helpful in showing the community, being a role model to the community to make positive behavior change according to what we are expecting. So and also promoting the specific superfoods that we have been promoting, like the 6 superfoods. It gives more specific, actionable messages. And the term superfood, it really is helpful in reminding the community that, okay, when I see an orange sweet potato, this is a superfood, this is good, so I have to consume it, my children have to consume it. So it's really helping them to relate the food that they are seeing as superfood, and it's beneficial to their children.
Yeah. Eva, there are those interested in the superbook cook food. Can you share them? Okay.
Sure.
Yeah, definitely.
Yeah, we'll be very happy to share the cookbook, but it's still in our language. We will take time to translate it into English so everyone can understand.
Oh, okay, we'll wait for that. So, Dawar, lessons learned from you. Can you speak a little louder, Dawar? I think the audio is. Thank you.
There were several key learnings emerged from the campaign, from the Narishma campaign, which includes developing context-specific and culturally relevant messages was crucial for engaging and resonating with diverse audience. The use of multiple communication channels, including social media, print media, electronic media, and interpersonal communication helped reach the target audience, including healthcare providers, women of reproductive age, and their immediate families with effective maternal nutrition messages. In addition to that, the second learning was the campaign's success was boosted by collaborations across sectors, including government agencies, civil society, the professional medical associations like Society of Obs and Gynecologists Pakistan, Pakistan Medical Association, and Health Service and Academia, allowing resource sharing, knowledge exchange, and a more comprehensive approach to addressing maternal nutrition challenges. So these were some of the learnings. There were many learnings, but if you want, we can share those as well. Yeah.
Thank you, Dawar. And I'm happy that you have emphasized this multi-stakeholder engagement and multi-stakeholder platform, because this is also what the Scaling Up Nutrition movement is really emphasizing. There are questions about the community engagement and the citizen voice action. I think these are questions that are, being asked for you both. So can you speak a bit about citizen voice action, Eva?
Sure. So for citizen voice and action, we use that project model to improve our health services, especially at the community level. So basically, we bring the standard documents, for example, in our strategy, national strategy, it says a health post should be open 24/7 for emergency, and should be equipped with all the basic supplies, and it should always be open. And in fact, for example, in some health posts, sometimes it's closed. So we bring these documents to the community, make them aware that they have the rights to speak for themselves if it's not happening according to what's being promised by the government. It's social accountability types of activity. So in World Vision, we call it, of course, a citizen voice and action. So from there, then we the service users and service providers will have a meeting to have a dialogue in terms of how to solve this issue. So that sort of thing, and then they will come to an agreement what each party can do to solve this kind of issue. So yeah, in a nutshell, that's what we do in improving the health services.
Yeah, thanks, Eva. Dawar, how about from your side? How do you engage communities? What kind of strategies do you do? And maybe one last question also for you is, I know that Pakistan is very strong in terms of influencing decision makers. So to what extent has this work on SBCC helped you in, influencing decision makers? Yeah, over to you, Dawar.
Well, thank you, Emily. So first is through the Narishma SBC strategy, we put efforts on integrating maternal nutrition into the building blocks of health systems. For this, we developed knowledge tools, products, and job aids to support healthcare providers and even the outreach workers who are working with the communities directly. So to facilitate them and to support them in implementing positive nutrition practices and services. For engagement of policymakers, yes, through the enabling environment component of the campaign, we engaged decision makers, policy makers, to support the maternal nutrition agenda in the country. And for this, we conducted a national policy dialogue on economic case for maternal nutrition, where government agencies, development partners, donors, key stakeholders, professional medical associations, they participated in those policy dialogues. So the policy dialogues were implemented at the national level as well as at the provincial level. And at the national level policy dialogue, the national level stakeholders and provincial level stakeholders signed a declaration to advancing maternal nutrition in Pakistan. And through that declaration, we ensured like long-term support for maternal nutrition as well as resource financing for maternal nutrition in Pakistan. In addition to that, we also conducted a pre-election policy advocacy, inviting different political parties. We sensitized them and ensured that maternal nutrition is integrated into their political manifestos to ensure long-term political commitment.
Thank you. Thank you for the meaningful experiences that you have shared, both of you, Eva and Dawar. I'm sure our audience, our participants have learned a lot. And I think they want to know more about your experiences. So there are more questions in the chat box if you can respond to them and share with them also further information about your experiences. So thank you very much. And I know that you're very excited to participate more in the breakout group. So I'm turning over to Kat. Kat, over to you.
Thank you very much, Emily, Eva, and Dawar. Wow, the Q&A and the chat is really on fire. So, and we heard you. We will make sure that the questions that were unanswered because of the limitation in our time, we will provide you with the responses on that. We will post it even in our website or in our landing page. You will get the link of that through your email. I have your email addresses with me, so don't worry. And together with the presentations, all the presentations that you have seen today, we will be sharing it with you through the landing page. So just wait for the email coming from me. Okay, so now there are 150 plus people in this webinar. I know you're eager to jump right into the breakout rooms where you will be able to have more time to really discuss in details, exchange ideas. So let us show the slides for the instructions for the breakout rooms. Okay, so you will have an opportunity to select the breakout room that you want to join in. So at the bottom part of your screen, or you will see this breakout room option, or if not, there are 3 dots there with more. So click on the breakout room, and once we are opening the breakout rooms, you will see the 5 options. Either photo voice, you will have the barrier analysis, you will have human-centered design as an approach, and then you have the mass media and social media, and then the positive deviance room as well. So we are very blessed to have Tasmia Bashar, UNICEF Regional Office in South Asia. She is the SBC expert as well, leading the human-centered design. And of course, you met Esther earlier. She will be leading the photo voice. Barrier analysis will be led by Graina Puselvi, our health and nutrition advisor. And then we have Lin Nguyen from Alive and Thrive Vietnam, a member of the SUN-CSN as well, leading the mass media and social media group. Breakout room, I mean. And then we have another member of SUN-CSN Asia. She is the the founding president, rather, of Gems Heart Outreach, Corazon Buenas Flores. Okay, so our colleague will open, okay, reminders, our colleague will open the breakout room, select that, and then hover over the room that you want to join and click join, and you will be released to your breakout room. We will be back after 25 minutes. So you will see a timer there, and then back in the plenary. So good luck on your conversation and enjoy. Lasantha, please open breakout rooms.
efficacy is talking about, do they have the efficacy to practice that behavior? Do they have all the support and things like those to follow it? And then the next is social acceptability. If they follow that particular behavior, are they accepted well in their community? And the next thing is self-efficacy. Do they have the efficiency to follow that particular behavior, or do they need support from the family? And cues for action is, do they need reminders to follow up on those behaviors, or are they able to do it by themselves? And the next thing is the divine will. Does the God approve? Because there is also the religion and the cultural belief and things that we work with. So do they think that it is appropriate in their culture and in their religious values that they follow? Is that behavior accepted? And do they also understand what are the positive things and the negative things that is connected with those particular behavior? So these are the 8 determinants, and this will be assessed using these 8 attributes. And how do we do this? How do we assess these behaviors? So there are 8 determinants what we have studied, but there is a process we follow throughout this. So the first thing is, we need to identify the particular behavior that need to be studied. Because we cannot combine different behaviors. So the behavior that we want to study should be very clear. The second one is, there is a standard barrier analysis questionnaire that is also, once you receive this presentation, you can click this and the link will take you through. It has both open and close-ended questions. So through the standard barrier analysis questionnaire, we should be able to understand what are the how can we contextualize it for the particular behavior that we want to study.
A voice from Papua New Guinea. Can I see the rapporteur who's with us, Natala? Could you kindly just give me a shout that you're here?
Yes, I'm here.
Oh, wonderful. And you're good to see you. And Nathaniel and I are going to be with you to facilitate this session, but we actually want to hear more from you. So let me just share my screen. And if you can just let me know if you can share if you can see my screen. Once you confirm, I will go to the presentation mode. Can everybody see my screen?
Yes, we can see.
Give me a shout. Okay. All right. So I hope everybody can see and can hear me all right. So for those of you who have actually used the human-centered design approach, you will be familiar with this. It's if I can refer back to our presenters today, Esther, Delwar, Eva, you have seen that insight and moving away, inside of the community and moving away from the traditional way we do our SVC programming is becoming more and more important. And HCD, human-centered design approach, is one of the way to get more insight from the community on their barrier and their challenges towards a desired goal. So it's locally informed, it's context-specific strategies to program outcome, to improve program outcome, and it actually helps us to understand the challenges faced by individuals and families in order to improve service and increase demand. So for those of you who may be hearing about HCD for the first time,
frequency also play critical roles. To maximize the impact, media efforts should be integrated with other interventions as well. Now I will move on another section. So in the realm of mass media, social media play a very crucial role in reaching and engaging audience effectively. In this section, I will briefly introduce our tailor-made tool designed specifically to support your social media effort. Following the principle of situation analysis, massive learning, audience testing, and also other following up steps, we have developed a comprehensive framework for social media to have us navigate its sophisticated and fast-changing feature on social media. So we have the available template and guidance for each specific step. So please scan the QR code in the slide for details. It is crucial to highlight that building channel is the key in social media. A Facebook fan page, for example, cannot be built only when needed. It takes time and effort to build trust and engage your community. Here is a very quick example of a personal template that guides us in visualizing our target audience. It highlights their interests, values, and influence, which in turn inform our messaging and channel selection. And this is the example of the empathy map tool included in the social media guidance that we have developed. It is designed to have deepen your understanding of target audience in relation to the problem. And I would like to give an example of ANT, the Asia Pacific Excellent Award-winning campaign in Myanmar, which is a 6-lakh campaign, which will mobilize parents to exclusively breastfeed their baby for the first 6 months. And this campaign utilized social media, including fan page, mobile app, and engaged like 50 macro and micro influencers for outreach. The campaign reached 20 million people in Myanmar in 3 months, showcasing the viral power of social media, right? And testing before and after revealed that 3 in 5 mothers associated with the campaign recognized the campaign message. In the image, an idol shared a video about breastfeeding at the end of his live show and also posted it on his social media channel to reinforce the message. The campaign, the success can be attributed to our practical and strategic design of the baseline and endline survey, which serve as a simplified form of the formative research. Stakeholder engagement with government agency and the private sector were also crucial. Our messaging focused on evoking like positive feeling and triggering love rather than fear. Finally, we emphasize a multi-channel approach to increase message frequency. As the saying goes, like to make a big leg move, we need to throw several stones at the same time. And this strategy have us like create a significant impact for the campaign. And that brings me to the end of my sharing, and I'd like to let you with a reflective question. So will the use of mass media and social media in social behavior change communication intervention will create inequality in program coverage or not?
Can you see the text? Hi? There's no text. So can I?
Maybe you can share verbally na lang po, ma'am.
I can share verbally. Okay. Can I open? Yeah. Can I open my? Excuse. Of course, the benefits here. Where's my? Sorry. I'll open first my what you call this? Sorry, huh? Wait. The benefits of this idol ko sinana, it's really comprehensive tool that really contribute to the development of the wider community. And also the other benefit is it empowers the participants or empowers the participants in terms of their decision making, of their influencing the wider community. And also it is also a holistic approach, which I found or I learned that the protection of children are included, and also it is influencing the local government units, no, and also and eventually uh, it will uh, it will contribute to a wider what you call this, the learnings and the attitudes, the change, the positive agents, and the impact of this is widely it is widely spread because of the support of the government in our country.
Thank you very much for this opportunity to share with you.
Okay, that is the presentation. Let me stop sharing. And then we will have time now for discussion, and Philip will lead us with Canva. We have 3 questions to discuss in this breakout room. So Philip, can you share the Canva because we have the questions there?
Hope you can see my screen. So you can find the link to the Canva in the chat. I'll be sharing it again right now.
So please go to the Canva link, and in the meantime, I'm going to share that there are 3 questions we will discuss as a group. The first is how or where can this tool be used in your organization? Maybe you can make it bigger, Philip. You can zoom in more. Yeah, thank you. And then the second question is, what are the challenges in this photo voice tool? And do you have any solution to suggest? And then the last question, what are the tools you want to explore if we conduct another learning webinar after this? So let's start first with the photo voice. So please go to the right Canva page because we have 5 breakout rooms. So please go to the right landing page in Canva for photo voice. Don't go to the barrier analysis.
Presentation is very, very interesting, and the barrier analysis is sometimes missing in the SBCC strategies. I just wanted to know maybe more specifically or with some examples how did you select the behaviors and the specific barriers and bridged activities and messages associated with a very specific example to be able to understand, to illustrate better the examples you were talking about. Thank you so much.
Okay. Yeah, so actually to come up with the behaviors, you should be
So let's say we come to Amena. We come to Amena and we have her intention. Let's actually talk about that whole service entry point we talked about. Let's say Amena has her, let's talk about the belief and other things that we had mentioned, her own perceptions. Do we have anything that what Amena would face? Let's talk about similarly used, all right, and okay, so looks like this as a mind map. Oh, very good. And who is okay? And the second, do we have any other? Let's say if we talk about Amina, or you know, what do you think from her to come from her perceptions? From her perception and her intention, what else do you think, you know, in the organization that we need to take care of? Any thoughts there? So
Anyone else? Or I can't see who is actually annotating since I have shared screen though.
I see 9 people are on the on the on the Canva.
Is it possible that I can just share the link though so everyone can type since I have not seen anyone who is contributing to it, right? So I want to see them typing here.
So this will be our guidance for our discussion. So what we will do is we would like to extract your best practices, your challenges in this area. So for those who would like to share, you may raise your hand or you may send it in the chat box, and our note taker, Miss Norlaila from CSA Indonesia, will be taking it here in the Canva link. So later on, we can share it in the wider audience. So for the first question, how or where can this tool be used in your organization? So this SBC tool, the positive deviance tool, or the ones similar to the first 1,000 days, maybe you have some similar experiences that the other countries and other organizations can adapt to.
How can you use this tool? Of course, we have as I mentioned, we have the program. We call it Enhance. Enhance meaning ensuring nutrition, health, and children's education, responsive and protective parenting. We have, as we work in our urban poor setting, we have different, we call it barangays, different areas. So every uh, not only a week, once a week, but monthly, or it depends on our schedule. We use this tool for in terms of as guide, no. And this tool is like training of trainers, like the you train first the facilitators, then they will be the one to train in the community. So this is an ongoing activity, no. So I cannot say when, how to, where this tool can be used in your organization. Almost the same when there are trainers training or any activities in the community. We usually use this tool because before, but not only but not this is not a sole tool that we are using. It is a complementary with the other tools developed by other agencies. Yeah.
Okay, thank you po, Tita Coring. So how about our attendees po, those from other organizations, other CSOs, other CSAs? Do you have similar experiences, or do you have prospect of where we can apply this approach or tool? Okay.
Aside from Gems Heart, we are also sharing this to other communities, and they are almost the same because this tool
take pictures and what pictures can be taken and what cannot be taken. That has to be really explained well, because the participant or the research participant, like the children or the mothers, or in this case also father can be participant, when they take picture, usually it's not just a selfie. It's not just themselves, but they will also take picture of their family, of friends, of neighboring environments or communities. So there has to be a clear understanding.
Seeing most of the people back in plenary?
Yes, I think they should be back. Sushila, can you share the screen?
Okay, so before that, again, welcome everyone. I know it was very tight conversation in the breakout rooms, but don't worry about that, because we will do something, to really provide you with more opportunities later on. So I have requested the resource persons to share highlights of your conversation, 2 minutes. I will be very strict with the time here of 2 minutes so that we will have everybody an opportunity to speak. And while that is happening, we will be sharing the Canva board that you filled up during your conversation. So the order of presentations would be, we first start with Graina, and then for barrier analysis, and then Esther for photo voice, Tasmia for the human-centered design. This is the very hot room there. A lot of people chose the human-centered design, I can see from our screen. And then, of course, the social media by Lean, and then Cora for the positive deviance. So over to Graina.
Yes. In our group, not many people have the experience of working with barrier analysis. So it was an orientation kind of facilitation with them. So I was able to respond to many questions they had around barrier analysis. But yeah, it looks like they want more information and reports and guidelines and documents if it is available. So that is what we discussed in our group. And so we were trying to understand the processes that were involved in barrier analysis. So we were just through with the second question, trying to identify what are the challenges. By then it was time for us to come back to the bigger group. But overall, I feel that people are much interested because it is with designing the programs in the field of health and nutrition. So it will be good to provide more information from whatever resources what we have. That's it, Kath.
Oh, thank you very much, Graina. And then congratulations for all the participants in the barrier analysis room. Let's now proceed with the photo voice, Esther.
Yes. So in our group, there was only a few people who have experience in using the photo voice tool, which is a qualitative research method and which is really useful also for advocacy. There are two emerging notes. First one is the importance of ethics, especially when we are engaging community, especially children and minors in photo voice method. So the importance of getting ethical approval and also informed consent. And there's also a photo release form that we have to get when we use this method. The second note is on cultural sensitivity, because we also need to understand, first of all, what is the custom for people, whether they would like to get their pictures taken, what kind of process usually. But so far, yeah, this is an emerging tools. It's getting more popular now. But we haven't really finished the 3 questions, so we haven't reached to the third question yet. But I would like to read more on the notes later on. Yeah, thank you, Kat.
Thank you very much, Esther. Good job for a photo voice group. Tasmia next for human-centered design.
Thank you so much. It was really so encouraging to have 30 participants in the room. And then, Papua New Guinea and Cambodia said that they're already using it. So very, very encouraging. Just the good thing is we managed to go through all the 3 questions, but of course the time was very short. So in terms of the first one, where can this tool be used? People felt that it is already being used in either mind mapping or for holistic design, because we went through the 6-point journey of HCD model. It brings the community and the service provider together. For example, it talks about the service provider, but also the very important fact of the service provider's own attitude towards the beneficiary. So people felt that it had a holistic approach. That was the first one. Secondly, on the barriers that they're facing, social norm came up as a huge barrier. And then, parents' time, which we don't often as practitioners take into consideration, that it's not only about giving information, it's do the parents have the time to actually use what they have learned? and who is helping the parents. So I remember Esther talking about the social ecological model. Everything comes there. And the third one, what else? What are other approaches would you like to learn from? I heard behavior insight. I heard solution design. So these were a couple of ideas, but of course we rushed through. But I want to thank the participants actually for engaging in this and already coming to the room with insights and their own ideas. Thank you so much.
Thank you very much, Tasmia. Indeed, the room was full, standing room for the human-centered design. And now we proceed with Ling for the mass media, social media. Over to you.
Thank you. Thank you for all the participants have like joined in the room, mass media and social media. And I see that like all people acknowledge like the importance of mass and social media because like we are now living in media environment anyway. But like I haven't got really many Q&A about the application of mass media and social media, except to how we can manage the stakeholder joining in the campaign. For example, the influencer, how to really make them commit to us, to our vision, especially when influencer are being now like reached by a lot of commercialized agencies. So that is the most concern. And the second concern is about the digital tool, on how to use the digital tool to support with the campaign. So we have time to address the three questions that you can see on the whiteboard, and they can see that there are a lot of like environment that they can use market and social media, and also the main challenge like an influencer as I mentioned, but also how to do the social media in remote areas. So the access visibility is a key problem here. Also the high cost of mass media as well. And the tool, I think they are looking to the social media analysis, social listening tool, and also how to accommodate the dance or theater, I mean art in media. So that is some feedback from the participant.
Thank you very much, Lynn. And yes, indeed, social media was also a good conversation. I was able to drop in that room earlier. And we proceed with Cora for the positive deviance.
Yes, good afternoon. First of all, sorry because I have a technical issue. I don't have the camera, open camera, then quite nervous. I'm joking. Oh, I'm so happy with the participants around the room because I think they're also attentive. And I appreciate one of the participants from Indonesia that shared about also the tool, and we want also to share it with them. And this tool is, as I mentioned, it is a complementary materials for the IYCF, no, infant, young, and children's feeding. So this is, I think, it's really common. However, the most important challenge here is um, how to disseminate, how to put it into practice, the what we call this, the strategies and approaches that they can use to attain the desired behaviors and practices in the community. So I think we also lack of time, but I think I shared also the highlights of this tool. Although it's a big challenge, yeah. And the big challenge here is how to influence this tool in the community that will create a more positive impact or deviance.
Okay. Thank you very much, Ate Cora, as we fondly call her here in the Philippines. Don't worry, again, the link of this Canva will all be shared with you. Okay, so anything that you have seen, you engage in inputting for this afternoon will all be shared with you. Now, on the question, we were not able to get enough time. So I would like to invite Grena for an interactive activity. Please stay because we really want to hear your voice. We want to hear your ideas on how we can deepen this conversation. Over to you, Grena.
Yes. Hello, everyone. So this is me again. Want to run through a short survey with you to take your inputs since we didn't have adequate time. So we will do this on Mentimeter. So we will be having 3 choices of how to log in. So there will be a QR code that will be shared. There will be a web link option, and there will be a code option. So yes, so here we have. So request you all to connect with your phones, use this QR code, use this Mentimeter site, or use this code to log in. Please log in. Please, all of you, take a moment to join. We are running short of time, so please log in. Let us finish this quickly. Yes. Were you all able to log in? Yeah, once you log in, please give the thumbs up mark so that we will know that you have joined. Please log in and give a thumbs up mark. Yeah, we can see people slowly joining. Can use your phone to scan the QR code. That will be an easy process. Yes. Yes. So yeah, now we have good number of people join. So let's go into the questions. So we have 3 questions here. Yeah, we also have the QR code in the next slide. So people who are still unable to join. Yeah, so we would request you to type in the country. Yes. Please type in the country where you are representing from. Yes. A lot of people from Philippines, Cambodia, India, Indonesia. Yes, good. Thank you. Yeah, if you have completed, give a thumbs up so that we know that we can move to the next screen. Yes, coming in. Yeah, okay, a lot of responses. Yeah, Timor-Leste, Nepal. Yeah, mostly from the Asia country, Asia, and yeah, not much from Pacific. Yeah, but Asian countries. Yeah, also from Sri Lanka. Yes, so let's move on to the next question. So this is what Kath has just mentioned. So if you go to the next question, you can see what aspects of SBC would you want to discuss more. So we are talking about having a second learning exchange event. So you would like to know from you, what are the options? What is that you want to focus on? Yes. Yes. Yeah, you can see the responses changing according to the number of people who have logged in. Yes. So right now we have behavior and social change as the leading one. Next we have community engagement. Yeah. Then we have, okay, it's too big. Then we have, yeah, we have interdisciplinary approach and multi-channel communication on the next. So please give in your responses. This is important for us as we discuss about the second session, second series of the learning exchange. Yes. Yeah. Please move on. If you have completed, yeah. Yeah, since due to want of time, I'm just going on to the third question, but I request you to give your responses. Then the third and the last question is, what specific tools and approaches would you want this network to discuss more? Today, we didn't have much opportunity to discuss in detail about those tools. So we still would like to have the tools which we discussed today and also added new tools. So please give in your responses on what do you want to discuss in the upcoming learning exchange. So we can see that there is more for human-centered design approach, the participatory design, and we can also see the photo voice tool is getting more attention. Also the human-centered design approach, the inclusive design. Okay, good to see a lot of people answering these responses, and I hope people have responded to the second question also, because we will be looking into them. Yeah, so we have the participatory design coming up as having the majority response. Yeah, and then the inclusive design and equity-centered design and also photo voice tool. Yes, so please, yeah, we find only 60 people have responded to these questions. Request people to add more to respond to these questions. Yes, so yeah, so we will not screen these. Yeah, Kat, I can go on to the next one, or you want?
Yes, please.
Yes. So talking about the next steps of this learning exchange, we are very happy for the participants who have joined today, and also for the stakeholders who have been very supportive from the start of this discussion. We thank you all for this participation. We are happy to let you know, just a moment. Yeah. So with all these inputs that you have given us today, so yes, we are still we will analyze these, and then we will share it in the upcoming communication. But with all these overwhelming responses, we are interested to keep up this momentum, and so based on this analysis, we will be coming up with the next series of learning exchange. So you will be kept in loop. Thank you for all those who were here. And in addition, we are also happy to let you know that there is an upcoming SBC Learning Summit, which will be in September 2025. So this summit will be organized by World Vision in Indonesia. And primarily, we would be focusing on the SBC guide that was released. This is a field test of the SBC field guide. So we want to disseminate the findings of this field guide. And in addition, the photo voice tool has been pilot tested. So we would be sharing from these two pilot tests during this dissemination. But we are happy to let you know that we are interested to collaborate with the stakeholders. So people who have joined from different entities today, please reach out to us if you are interested to be part of this Learning Summit in September 2025, and we will be happy to collaborate with you. Likewise, with SUN-CSN, with UNICEF, with World Food Program, and others who have joined today. So please join us in this upcoming Learning Summit and the second series of Learning Exchange. So please connect with us, and we will also reach out to you simultaneously. Yes, thank you. Over to Emily and Kat.
Thank you very much, Graina. And thank you, everybody, for joining. I know we are 7 minutes over time, but please do expect an email from us about the resources. We will be sharing it all with you. And then we would really appreciate if you can join us again. As what we are saying, this is a partnership, and we will continue to be a partners for our fight against malnutrition. Thank you, everyone, and have a good rest of the day. Have a good rest of the week. Thank you, and we really appreciate your time. Bye.